The practice of emergency medicine at Johns Creek, for me, encompasses everything that I would want as a patient if I were to need emergency services. We have a full spectrum of healthcare options. Almost every specialty you can imagine is staffed here at Johns Creek, and as an emergency physician, to have that type of backup really adds to the confidence in my ability to take care of any and anything that would walk through the door. There's nothing more important than time. It can mean the difference between life and death. Patients who are experiencing life-threatening events such as a heart attack or a stroke, if you wait 15-20 minutes, it may mean the difference between a partially blocked artery and a fully blocked artery.
I'm Dave Hofstetter, and I'm probably sitting here as a result of the diligence and dedication of Dr. Hogan at Emory Johns Creek. He determined two blood clots that I had right after a hip replacement, feeling fine hip-wise, but I had just a persistent cough that I couldn't get rid of. Decided to go into the Emory Hospital here because it's just around the corner. Dr. Hogan came in and said, do you have a little time? I said, well, yeah, sure do. Nothing but walking around on my crutches. And he said, well, I'd like to do a whole battery of tests.
Lieutenant Colonel Hofstetter obviously is one of those patients that sticks out in your mind. He and his wife were here at a time of duress. They had gone through 2 weeks of not knowing what's happening and not getting any better.
We do an annual bicycle trip to France every year. This will be the 8th year. It's a fantastic time. It's not the Tour de France. It's an executive bike tour. We ride maybe 25 to 30 miles a day, interrupted frequently by beer and wine stops.
When you see a patient come in initially and they're scared, or they're in pain, or they're sick, that transition from fear to calm to relief to recovery, you can really see a transition in their personalities and their interactions with both the physician and the staff. And generally patients will turn around mid-visit, and even our grumpiest patients will leave here with a smile.
There's really no telling, with not having Dr. Hogan and not having him identify the blood clots could have led to something extremely serious. I might not be going on the trip. Might not be doing a lot of things.
It's great to know that he has recovered, that I had a little bit to play in that. Every resident of Johns Creek, I feel, should know that if they need anything from a healthcare standpoint, Johns Creek Emergency Department is capable and available 24 hours a day. I'm Dr. Mark Hogan, and I'm very proud to be a part of the team at Emory Johns Creek Hospital.